By the show of hands, how many of you guys know what euthanasia is or have ever heard about it? Hello, my name is Selmy Rodriguez, and today I will be informing you all on the topic of euthanasia. I will talk about what euthanasia is, why people do it, and where it is legal. Well, what is euthanasia? Euthanasia is a less painful way of killing someone who suffers from an incurable disease. There are two types of euthanasia, voluntary and involuntary. According to the website Medical News Today, voluntary euthanasia is conducted with the patient's consent, meaning that the patient gives the okay to go on with euthanasia. Involuntary euthanasia is conducted without consent, meaning that someone else makes or decides for the patient because they are unable to do so. And usually the person who gets to decide this is a close family member. There are two classifications of euthanasia, passive and active. The same website, Medical News Today, mentions that passive euthanasia is when life-sustaining treatments are not given to the patient. An example of this would be a cancer patient denying chemotherapy or other pain medications. Active euthanasia is when a lethal substance or forces are used to end the life of a patient. The patient might conduct this. An example of a lethal substance, or one that I saw, was actually in the form of a liquid, so the patient drinks this liquid and it terminates their life. Why do people go through with euthanasia? Many people that go through with euthanasia usually have terminal illnesses or very painful diseases. One reason they consider euthanasia is because they fall into depression after learning that their lifespan is shortened or that they have a really painful disease. The article Factors That Influence Consideration of Hastening Death Among People with Life-Threatening Illnesses by Elizabeth Mayfield Arnold claims that in case studies of people who believe they had cancer, a common factor among the individuals was a current diagnosis of depression with no previous psychiatric history, meaning that a person who had a healthy mental state prior to knowing that they had an incurable disease had depression after they learned that they had a disease. Also, Mayfield talks about a study on long-term male survivors of AIDS and how 57% of them had thoughts of suicide when they learned that they had AIDS. Again, they fell into depression and had suicidal thoughts because they learned that they had AIDS. Terry, Olson, Wills, and Bolton Lewis. Another reason that people go through with euthanasia is because they don't want to take pain medications. Terry, Olson, Wills, and Bolton Lewis, authors of the article Experience of Dying, Concerns of Dying Patients and of Carers, says that for few patients, taking large numbers of medications was distressing. A lot of the people who suffered from incurable diseases had to take large numbers of medications, and a lot of them couldn't keep track on which medications they had to take or which ones they had already taken, so it was very frustrating for them. Also, a lot of these medications had severe side effects, so the patients felt bad actually after taking the medications than prior to taking them. Furthermore, the same article mentions that people want to go through with euthanasia because they don't want their family members to see them suffering. It's hard for a family member to see a loved one suffer from an incurable disease, so a lot of these patients actually wanted to go through with euthanasia so that their family members couldn't see them having cancer or having a slow, painful death. They saw that euthanasia was a better way to pass away. Where is euthanasia legal? Euthanasia is actually illegal in many countries. In the US, it is illegal for doctors to physically euthanize a patient according to the website New Health Guide, which means that a doctor themselves can't force or give the patient the lethal substance themselves. The patient has to take it. If the patients take the lethal substance themselves, then it is not illegal, and this is actually permitted in Oregon, Washington, Montana, and Vermont. Even though in the United States, doctors can't physically euthanize patients, they can in some other countries. Some countries that the New Health Guide mentions where it is legal are Belgium, Colombia, India, Ireland, Luxembourg, Mexico, and the Netherlands. In addition, the research article Physician Experiences with End-of-Life Decision-Making survey in 6 European countries and Australia by Rurik Lofmark, Tor Nilston, Colleen Cartwright, Suzanne Fisher, Agnes van der Heide, along with other authors, state that physicians in the Netherlands have the most experience with euthanasia. This is because, one, it's legal there, so a lot of people can go through with euthanasia without worrying about being persecuted. And a lot of doctors have more experience there because, again, it's legal. Those are the basics on euthanasia. Since euthanasia is not permitted here in California, it is not something that we often hear about, but it is something that happens around the world. It is a controversial issue, and if you guys would like to know some of the reasons why it is, I encourage you guys to use the databases. There are tons of articles that talk about the controversies and why it's legal in some states and not in others. Today I hope to have taught you the basics on the topic. I have gone over what euthanasia is, why people do it, and where it is legal. Thank you.